All right, so for a second time under the Trump administration, House Republicans will try to repeal and replace the Affordable Care Act. But this time, they say their bill will pass. The plan, brought together with the help of the president, would bring drastic changes to the signature legislation of the Obama administration. The deal was finalized with an $8 billion amendment aimed at protecting Americans with pre-existing conditions. But the top Democrat in the House says the bill is too costly and a moral monstrosity. Nancy Cordes has more.
Need a CBO score.
Republicans and Democrats clashed in a late-night session, paving the way for today's vote.
This process, to put it bluntly, is a mess.
Because we have enough votes. It's a good bill.
GOP leaders and the vice president have spent the past 3 days leaning hard on undecided Republicans.
How many people have changed their votes from no to yes?
There have been a number. I'm not going to get into the details.
10?
Some holdouts were swayed by last-minute tweaks to the bill.
I'm happy to announce that the people in the 7th District of Missouri will have pre-existing conditions covered adequately with this addition that we just talked the president into.
The GOP plan would reduce Obamacare's subsidies for lower-income Americans and eliminate taxes on the wealthy used to pay for them. Instead, people making less than $75,000 a year would get age-based tax credits. The bill seeks to lower premiums by allowing states to opt out of Obamacare's minimum coverage rules, which require insurers to cover things like maternity care and emergency services. States could also allow insurers to charge higher rates for some with pre-existing conditions, but only if those states set up high-risk pools to help people afford it.
This is sort of a fig leaf to try and win people over.
Democrats argue the plan has been panned by most major interest groups, including the American Medical Association, the AARP, and the American Cancer Society. Republicans argue Obamacare has its own problems, with insurance providers pulling out almost every month.
But what's going to happen if Congress does nothing when you've got states like Iowa that might end up with no insurers in the individual market?
It's up to the Trump administration, once they can't pass a bill, to work with us to improve Obamacare.
CBS News chief congressional correspondent Nancy Cordes is on Capitol Hill and joins me now. So, Nancy, the Republicans are positive that they have the votes to pass this thing.
That's what they say. According to our unofficial whip count at CBS News, there are still about 16 Republicans who say they're voting no. And there are many more who are officially undecided. Now, have they told Republican leaders in private, if you need me, I'll be there for you, I'll vote yes? Probably. And that's probably what's giving Republican leaders the confidence that they have the numbers to go forward. But it is going to be a squeaker, Anne-Marie, and that is why the minute that Republican leaders decided that they had what they needed, they said, let's not wait, let's not, let people go home for a week, let's hold the vote right away.
So here's the thing, though, Nancy. The Congressional Budget Office has not added up the estimated cost for this thing. We know that amendments were being sort of pushed in as late as yesterday. So do we really know who benefits the most from this new health care bill? Who will benefit the least from it? Do we know the details?
We know some details about who might win, who might lose as a result of this plan. Most experts from the right and the left seem to agree that Americans who are younger, who are healthier, who are wealthier might do better under this plan. And that's the result of a few things. First of all, a lot of wealthy Americans will get tax cuts as a result of this bill. They'll no longer have to help pay for those Obamacare subsidies for low-income families. And on the flip side, people who are low income, who are older but not yet Medicare age, they might see their costs rise because the Republican plan is not as generous for them as Obamacare was. Republicans will argue that Obamacare was too generous, and it placed too many restrictions on insurers, which drove up premiums for everybody. So there's a real difference in philosophy here. But what seems clear is that if you're an older American, if you have a pre-existing condition, your coverage might cost more than it does now.
Now, during the last attempt to pass this health care reform, the president tried to woo the more conservative members of his party, and at times he threatened over Twitter, that's going to be tough for them to get reelected. I'm wondering what we know about the president's influence this time around.
Well, what Republicans will say is that he was helpful in one-on-one situations with members. He's a very forceful presence. If a member who's undecided sits down with him or talks with him on the phone, it's hard to resist some of his entreaties. On the other hand, some of his public pronouncements were not that helpful because it was clear that when it comes to the details, he has sometimes been confused about what is in the bill, what isn't. He has sometimes misrepresented what is in the bill and what isn't. And that has created a challenge for Republican leaders. Either they have to disagree with him publicly or they take it as a message from him that he wants something in the bill that isn't currently there. So that has created some headaches. But publicly, what Republican leaders will say is that his presence was helpful. His attempts to sell it to the public were helpful. And you've got to remember, Anne-Marie, that despite all the drama we've witnessed over the past couple months, this is really still just the beginning of the process. Whatever comes out of the House is undoubtedly going to be changed significantly when it goes to the Senate. Republican senators have already said that. Then it's got to come back to the House and get support and buy-in once again from conservatives and Republican moderates alike. And we've seen how tricky that can be.
Yeah, that's a really good point to bring up. You touched on, what the president knows about what's in the bill and what's not in the bill, who the losers are, who the winners might be. But I'm wondering what doesn't change. There's an awful lot about the Affordable Care Act that people liked. And
right.
Presumably the things that people like will stay. That's what the president promised. Is that the case in this legislation?
Yes and no. I mean, there will still be federal money for people who are on the lower end of the income spectrum to help them buy insurance. The money that they get is calculated differently. Some people will get more, some people less than before, but those funds will still exist. People with pre-existing conditions will still be protected, but in a different way. Could that mean that some people who have pre-existing conditions now might be treated differently? Absolutely. So, for instance, what Obamacare says is that insurers can't treat people with pre-existing conditions differently. They can't charge them more than healthier people. What the GOP plan says now is that if states want to opt out of that requirement, they can. With the idea being that allowing insurers to charge people with pre-existing conditions more means it gets cheaper for everybody else. But then states would have to create these high-risk pools, and there will be federal dollars for that, to help them cover some of the costs for those people with pre-existing conditions. Democrats say you're not putting enough money into those high-risk pools. High-risk pools don't work very well. So in the end, people with pre-existing conditions will get hurt. Republicans argue it is enough money, and they say most states won't opt to waive those Obamacare requirements, so it won't matter anyway. Frankly, a lot of this is untested, so it's hard to say who is right about the best way to handle people with pre-existing conditions, for instance. And because we don't have a score from the Congressional Budget Office on this latest version of the GOP bill, we can't say for certain how much this plan is going to cost and how many people might lose coverage as a result of it.
Right. Nancy Cordes, thank you so much.
You're welcome.